Well, I had my surgery a month ago. John and I were litter mates, and it went very well. I did have one surgical complication. When Dr. R got in there, I had some adhesions from a gallbladder surgery, so it took him about twice as long to do my surgery. And I'm very grateful to him that he went ahead and did it, because he admitted he thought about not doing the surgery a couple of times.
I was whining. Oh, this is so hard.
I probably was too.
Well, after you had some pain post-op?
I did. It was kind of up here in my shoulder, and speculation of people that probably don't know much said it was the gas kind of settling up there, which it may or may not have been, but it every day it got a little bit better, and then in a week it was gone. It concerned me at first, but it turned out to be a non-issue. That's the only physical problem I had. The first couple of weeks was surprisingly easy to do. I was concerned about it prior, thinking that the liquids would be this big sacrifice, and how was I going to make it? You're not hungry. You just don't care. Eating becomes an intellectual decision rather than a habit or a hunger or a...
All right, say that one again. We got to hear that one again. Is that true? Do you agree? I mean, she's not making that up, is she? I paid her $20, but that's the truth, and that's the truth, right?
I'll see if the check clears.
So tell us that again. That's very hard to believe.
What, that eating has become an intellectual
Well, pre-operatively, how did you feel about food? The same as post-op? Are they different?
Oh, heavens, yes, they were different. Food was my comfort and my crutch. I spent 25 years as a marketing manager with a major oil company, and literally my job was to go around the country whining and dining to people. So it's a huge lifestyle change for me. And I was very concerned about that ahead of time, thinking that, how am I going to do this? You know, this is a 25-year habit.
So you like to eat pre-op?
Of course. Very much so.
Yeah. And so after surgery, you don't like to eat as much?
No, I really don't.
Isn't that, and I think that's, when you say that, it sounds kind of, but it's remarkable, isn't it?
Oh, yes. I guess the only thing I miss is coffee, and that's the smell of it, and it's in my head.
Right.
But that's really the only sacrifice that I would consider making post-op.
Do you think it was a worthwhile sacrifice? Would you trade that?
I think so. Yeah. Now, I've been a little slower to lose than most other people.
I've seen your emails about that, and I was going to kind of correct you. Now, John, you were at 295, and you lost 35 pounds. And you started off at?
I started off at 218.
Okay, now wait. 218, 295. And you've lost?
I've lost 18 pounds.
Okay, so you're starting at a lower weight. So 10% of his body weight is just about 30 pounds. And 10% of your body weight is just about 20 pounds.
Okay.
So you're actually doing, I noticed your emails about this. You're doing great for somebody starting at 200. If you had lost, like the other people that you're envious of, we would be worried that we'd be seeing you back here too thin.
Okay.
You're perfect for somebody who starts around 200.
Okay.
We can make people too thin. You don't want to be too thin.
No.
18 is perfect for your first month, starting at 218.
Okay.
Yeah. We can hurt people with the surgery. If you lost how much?
30 pounds.
30 pounds, okay? That's good for 300. Almost 20 pounds, that's good for 200.
Okay. Makes
Really,
sense.
seriously, you don't want to lose too much. We can take you down so that you're so thin and so sickly, you have to have another surgery. So 10% of your body weight at 1 month, you're close to that, and that's perfect.
Okay.
You're right where I would like you to be, in that mid number. If you were 250 or 300, 18 would be lower than I'd like. But not for somebody with 218. And also, you're not 25. If you're 218 and 25, I can hit harder on the body and not hurt people. So 18 is perfect for you.
Well, speaking of the age thing, that was kind of a concern too, because I'm 62 and I felt that maybe I had a little bit more risk than younger folks. And that turned out to be not a concern whatsoever. I've had no problems.
Yeah.
I took blood pressure medication prior to surgery. The last tablet I had was the morning of surgery. This morning, my blood pressure was 129/67.
And we expect that to kind of continue going down. And again, losing too much can lead to hypotension and sickness and things like that, so you're right on target.
Oh, I'm not complaining anymore. I mean,
Okay.
the board was really good. A lot of people kind of jerked me short and said, hey, wait a minute. So,
Well, I didn't say anything, but I kept seeing these emails. You go, oh, I'm a slow loser, and everybody else is losing more. But wait, you started at around 200. This is right. You're doing fine. And again, if we had 25 or 30 pound weight loss in you, that'd be dangerous. That'd be likely to lead to another surgery a year from now where you're thin and sickly and unhappy.
I'll pass that.
Yeah, you're right on target. Right.
Okay. I guess the last comment that I would like to make is that obstructive sleep apnea was a big issue for me, still is. I just don't know the degree of it. I thought I would wait 3 or 4 more months, then go have a sleep study, and if it cures that, oh man. I wanna
We're
get
like
this.
80 to 90%. So Las Vegas is kind of a place where we bet. I
Yeah.
bet you're going to be done with that sleep study.
I can't wait.
Yeah, good. Any questions?